Good day, I'm Valerie Anim Cortez, and today I will be doing the administering oxygen by cannula or face mask. So the rationale for doing this procedure is to deliver an oxygen gas so that it will help the patient to breathe. So the patient also can receive oxygen therapy from tube resting on their nose or by face mask or a tube placed on their trachea or a windpipe. So prior doing all of the procedure, we need first to verify the doctor's order. The rationale is for us to be sure if we are doing the right thing or if we are giving an appropriate procedure to the patient. So next is we need to prepare all of the equipments that we will be needing. So for this procedure, we need to have a simple face mask. Next is the cannula or the nasal cannulate. And then next, of course, we also need to have an oxygen equipment such as this oxygen tank together with the humidifier and the flow meter. So these equipments are all improvised because we are in a pandemic and we are doing an online learning. So after that, we need to perform a hand washing technique or observe other infection control procedure. The rationale is to prevent the spreading of microorganisms. And also, we have to identify the client and explain plan and procedure to him or her. Rationale is for us to verify if we are handling the right client, and of course, in order for him or her to have an awareness that we will be going to do or how he or she can cooperate. Next is we have to provide the privacy all throughout the procedure. The rationale is in order for the patient to be comfortable while doing the whole procedure. So now we'll be setting up the oxygen equipment together with the humidifier. So let us assume that this is now the oxygen equipment together with the flow meter and the humidifier. So the first thing we have to do is to attach the flow meter to the wall outlet or a tank. So let us assume that this is now attached. Next is we have to fill the humidifier bottle with distilled water if needed. So let's assume that it is now filled. So next is we have to attach the humidifier bottle to the base of the flow meter. So let us assume that it is already attached. And of course, after that, we will now attach the prescribed oxygen tubing and delivery device to the humidifier. So after that, we have to turn on the oxygen to the prescribed rate and make it sure that it is flowing correctly. We have to check if the oxygen is flowing through the tubing and then set the oxygen at the flow rate as ordered. Of course, it is that we follow what is the order. So after that, we will now apply the appropriate delivery device. We are using a cannula or nasal cannula and a face mask or a simple face mask as a delivery device. So firstly, the nasal cannula. In using this kind of oxygen therapy, the patient is able to eat, drink, and speak because it is a lightweight and also it is much more comfortable for the patient to wear. So before doing that, we need first to introduce ourselves to the patient. So, hi ma'am, I'm Valerie Anim Cortez and I'm your caregiver for today. So today I will be doing the administering oxygen by cannula and face mask. Is that okay with you, ma'am? Okay, let's begin. So the first one is the nasal cannula. So in doing this, we need to put the cannula with prongs downward and we'll put it on around the patient's head, and the elastic band should surround the ear of the patient under their chin. So if the cannula cannot stay in place, so we have to put a tape on the face of the patient so that it will stay in place. So next is we have to patch tubings and bend over ears and cheekbones only if needed. So, ma'am, I'm gonna be putting the nasal cannula. So now it is bend on the ears. So there we're done on the nasal cannula. So let's now remove. So now let's proceed on the simple face mask or the face mask. So it is often used on the clients who has minimal respiratory distress and usually used for mouth breather patients. So in doing this, we need to put the mask on the client's face and attach it on the nose and downward. Next, we have to fit the metal. So here, this is the metal on the nose of the patient. So it will contour the face of the patient and he or she will be comfortable. So we have to secure the elastic band so that it will not move and it will fit on the patient's face. And then next, we need to pad once behind the patient ear so that it will be secured. So that's how it looks like. So, and there is a tubing so that it will connect on the humidifier. So, after doing all of the procedure, now let's remove. We have to assess the client's vital sign, also the level of anxiety and the color. So, when the procedure is done, we have to aftercare all of the materials that we use and then document all of the procedure that we've done. So that's all. Thank you for watching.